Mr. Guthrie for his 5 minutes of questions.
Thanks, Dr. Cohen, for being here, and thanks for hosting me in Atlanta and getting to meet your good team. And I will tell you, there are a lot of hardworking Americans in your building trying to make sure we're protected and safe, and we appreciate that. I enjoyed my time there. And as you know, as we discussed, and it gets to, I wouldn't say that I'm whining about COVID. I'm my good friend from Colorado. She is my dear friend. We're not, but we have lessons learned. We lost some faith in a lot of institutions. I'm going to talk about WHO and some others, and I believe you're working to try to do that. And I think we have to work together to try to do that. But just instances that happen, and there's one. It's one of the letters that we had sent to you from the leadership of ENC about the COVID tracker data. I think there were 72,000 deaths that were removed from the CDC COVID tracker website. I think you said it was not you personally, but it was a glitch. There was also CDC's National Vital Statistics System showed less COVID-19 deaths in kids than was previously reported. And so would you explain, I know those are two separate situations, explain those and then what you have done? Because what your group showed me what they want to do with the data. And I believe the people sitting in that room were wanting to use it to give good information for them to protect the American people. The question we have, and we talked about it in other things, is how can we ensure data is being made private? And when you see some of these mistakes and lack of transparency, it's hard to make that case, and I think you want to make it. And so would you talk about those specific instances and then what you've done to fix them?
Yes, well, thank you, Representative Guthrie, and I really appreciated the visit down. Making sure that we have timely and accurate information is critically important. And this, I think, when we look at our mortality data or our death data, this is a success story over the course of the pandemic. At the beginning of the pandemic, the way we were able to report death data was quarterly. It wasn't quick. It wasn't in real time. But we know the pandemic was moving so quickly that we had to report more quickly. And so we used a different mechanism to report death data through case surveillance data. It was essentially the state and local folks were collecting that data and would give it to the CDC. We caveated at the time to say this is preliminary. The gold standard, which was not as timely at the time, we were still reporting, but again, it was slower. We made a lot of improvements. Again, thank you to Congress for those resources, where now we can almost get real time in that gold standard data. And that is what we are using. We were able to sunset those case surveillance data that you were referring to. So we are now in a better place related to our timeliness and accuracy of the mortality. And look, we're still looking at 1.1 million adults that have lost their lives, so there's 1,700 kids that have lost their lives to COVID. So we do have to use all the tools at our disposal to make sure we're protecting folks.
Okay, thanks. And you talked earlier about I was going to ask you about what's going on in China now, and your assessment from what you know is that it's not a novel virus?
Correct. Not a novel virus. Again, we have been in close touch with our counterparts in China, and that information has been corroborated with other counterparts across the U.S. government, but also with our European Union partners as well. So we feel confident that information has been corroborated.
Because one of the institutions that I feel really failed was the World Health Organization. They seem to defend, this is my assessment of it, defensive of China when this COVID broke out, when they were doing the indefensible, not sharing information so the rest of the world could react to it. And they have requested specific data from China for this current outbreak, and specifically recent trends in circulation of known pathogens and so forth. Is China responding to the World Health Organization? I know you have people in China that are dealing with their Chinese colleagues. Do you think the World Health Organization is responding in a way that it should, and do you think China is working with them to from what you can corroborate?
Yeah, I don't know firsthand about the WHO and China interactions. Our information is direct from our teams who are in our China office with our counterparts. But my understanding from WHO is that China has been sharing information related to this, and so again, another way to corroborate.
Okay, thanks. You know, also the World Health Organization asked China for information in December of 2022. So I guess just to summarize, I'm about out of time. I know we have our own personnel in China for the CDC, and you feel confident that China's being transparent with them as for the information that you have?
Well, I think, scientific diplomacy is incredibly important in that part of the world. We do have a small office, and we are trying to work on things that are mutually agreeable. But I'm sure we would love to do more work, and I'd be happy to talk more about
If it was coming straight from scientists, you're probably different than, I know they have to work through their government as well. But thank you for your work and appreciate, and I yield back.